Hello and welcome back to GCSE Science Simplified. In the last episode, we explored how non-communicable diseases develop through interacting risk factors. Today, we're focusing on what happens once cardiovascular disease has developed and how it's treated and managed. Cardiovascular disease rarely has a single cause, so it rarely has a single solution. Doctors usually use a combination of treatments to reduce the immediate risk, manage the symptoms, and prevent future problems. These treatments fall into three main categories. The first being lifelong medication. Now, this medication can help lower blood pressure, reduce cholesterol, and reduce the risk of blood clots. These drugs can be highly effective at reducing the risk, but they usually need to be taken for the rest of a person's life. Now, this medication treats the condition, but not always the underlying lifestyle factors. Secondly, quite invasive, but we've got surgical procedures. This can work by inserting stents to widen narrowed arteries, bypass surgery to reroute blood flow. Now, these procedures can be life-saving, especially during emergencies. However, surgery does carry a risk, and it's expensive. And finally, they don't prevent the disease from returning if the risk factors remain unchanged. This is where lifestyle changes come in. Now, these lifestyle changes can include improving diet, increasing physical activity, stopping smoking, or reducing your alcohol intake. These changes often provide the greatest long-term benefit, but they can be difficult to maintain. That's why they're usually combined with medication, and in some cases, that's surgery. Right, let's review this. I'm going to ask some questions to get you thinking, just so that then it sticks in your head a little bit better. First, why is cardiovascular disease often treated using more than one method? Second, why might surgery alone not be enough to prevent future disease? And finally, which treatment option has the greatest long-term impact on health and why? Let's wrap this up. We've looked at cardiovascular disease, and it's managed using lifelong medication, surgical procedures, and lifestyle changes. The most effective treatment plans address both the symptoms and the causes. We'll be exploring health further in our next episode. Thanks for listening. This has been GCSE Science Simplified. If you like what you hear, I'd love it if you followed and get notifications about our next episode. See ya!